going to go ahead and get started. First, I'll introduce Dr. Nick Campitelli. He's a podiatric surgeon known nationally for his expertise in minimally invasive bunion surgery. He's in the Ohio area. In 2015, he joined the multi-specialty group Unity Health Network, where he has since become the primary foot and ankle surgeon for the group. He serves as chief of podiatry at both Western Reserve Hospital and UH Portage Medical Center. Additionally, he's a consultant for Arthrex, contributing his expertise to the development of innovative surgical techniques and tools. Beyond his clinical and surgical achievements, Dr. Campitelli is a prominent digital creator, boasting over 800,000 followers on social media. He's board certified by the American Board of Foot and Ankle Surgery in foot surgery and reconstructive rear foot and ankle surgery. His commitment to education is evident in his role as residency director for the Western Reserve Hospital residency program, where he mentors the next generation of podiatric surgeons. Welcome to podiatrymeetings.com webinar.
Wow, thanks, Anne. That was a great introduction. I'm not used to those.
Oh, yeah. Well, I'm skilled at these, you know. So I am going to turn off my camera and mute myself so that I'm not a distraction, but you go ahead and take it away and we're all ears.
Excellent. Well, thanks. Thanks again for everyone that joined in tonight. Orthotics can sometimes be a dry topic to discuss, and I'm going to try and make that a little bit fun tonight. Always add a little bit of controversy and get through this topic of rethinking orthotics and how we improve patient outcomes. For those who don't know me, I think Anne kind of gave a little bit of an introduction, obviously. I practice in Ohio, and I also am a residency director, and I really take education seriously. I love educating. If you haven't found my YouTube channel, it's a lot of fun. The goal when I started it was to provide education for students, residents, fellow surgeons and colleagues, and as well as the patient population. So the goal at some point is to have a complete archive of everything that I have done over the last 20 years, both video and pictorial wise, to help other surgeons and students and everyone else learn how we operate in surgery, how we see different pathologies in the office, and help us become better diagnosticians. So let's get started. So over-the-counter orthotics. We're going to talk about what the biggest reason is that patients are dissatisfied with their insoles in their shoes. And we'll talk about how the misleading marketing that's out there turns into wasted money for patients that comes out of their pockets that leads them in the wrong direction. While it might seem simple to us on how orthotics or shoe inserts work, the patients sometimes don't understand that, or they're misled. And then we'll talk a little bit about the evidence behind over-the-counter orthotics and how it demonstrates an affordable and effective alternative to custom orthotics. I think the biggest problem that leads to patients being dissatisfied is what's causing their foot pain. And I think they don't understand, I'm sure many of you listening tonight have had a patient that's come in and said, you ask them, what are you doing here today? And they're like, well, you tell me. Or they point to their foot, and they'll say, oh, my foot hurts. Well, there's a lot of different moving parts to that scenario. There's 26 bones in the feet. There's a whole bunch of joints, nerves, tendons. And, that frustrates us when we hear that, but the patient doesn't get that. So I think a lot of times they'll jump to solutions to fix their foot pain without understanding what's happening. So it's frustrating to us, but yet we have to go back and try to understand what they're saying. So I think that leads to them having frustration. And then where do these patients turn for answers before they come to us? They turn to their friends turn to Google, they turn to Google. So I think it creates a whole, a misunderstanding of how we attempt to treat foot pain with a shoe insert or an orthotic. So this is a fun slide because this is where custom orthotics should be. And I use this a lot in trying to educate to both patients as well as students on how our industry, I think, has kind of been tainted or been misunderstood about how we use orthotics. So that blue bar represents the normal foot, and the flat part to your left and the high arch part to the right is a pathological part. And I think that's where a custom insert should be used. But over the years, abuse has placed it into this category where the normal foot is a small blue section, and we treat what we call flat feet and high arch with custom orthotics. Now, I don't want to dump over the counter orthotics into this same arena. This is just a custom orthotic. So, how has that happened? Well, to use an analogy, and this might not be the best analogy, but a pair of sunglasses is, at the end of the day, for most people, is designed to do one thing, and that's prevent your eyes from squinting and becoming from getting headaches and being out into the sun. You want to prevent your eyes from getting all that bright sunlight. You could buy a $191 pair of Ray-Bans, or you could go on Google Shopping and find a pair for 52 cents. Or you could even get a pair of these Adidas, which I'm not even sure what they are, for around $1,000. But at the end of the day, they're kind of all accomplishing the same thing, aside from style, but they're preventing sunlight. Now, one could argue the polarization and that sort of thing. But the analogy that I'm trying to draw is, if you have a business, I think that most people somewhere along the line are going to sell the higher priced item, or if the higher priced item isn't selling, they'll sell the second most higher priced item, which would be the Ray-Bans. And I really think that's where custom orthotics became abused. Insurance companies were paying for them. Patients were coming in and saying, I think I need a shoe insert because I have flat feet. They may or may not have flat feet. And it was very easy to mold that patient for a custom orthotic and get one. Well, times have changed. Science has changed. Studies have come out that have changed what we know about foot function and how we can treat that foot function. So instead of just jumping to that $600 custom orthotic, we know that over-the-counter orthotics can help. So that's one piece of the puzzle. The other part of the puzzle is, when we look at what's causing the pain, it's not always treatable with an orthotic. Now, some of these items that I have listed on this slide, like toenails, hammer toes, bunions, neuromas, can we treat a neuroma with an orthotic? You can. I think it's challenging to get that pad in the right spot. And the point that I was trying to draw from this is, if you place a patient into a custom orthotic that you charge them $700 for, and you get that neuroma pad in the wrong position, they're going to be upset. They're going to tell their friends and family, don't go to this person. He charged me $700. He put this insert in my shoe and it didn't work. Now, I'm not bad-mouthing orthotics. I'm just, I guess, demonstrating how they can be used incorrectly, and it can lead to frustration. Now, some of these other pathologies that are up there, such as great toe arthritis, yes, that can be treated with an orthotic, but it can also be treated with a carbon fiber insert that can go into the bottom of your shoe. There are now options available from PowerStep. We'll talk about those a little bit later. But for the most part, just a general orthotic isn't going to help great toe orthotics. A bunion, while it's theorized that you can reduce hyperpronation with an orthotic, which is also even debatable because you can collapse on the orthotic. That's not the topic of what I'm getting at. Is, if you have a bunion, it not necessarily is going to improve by putting an insert into your shoe. So I think patients are getting frustrated when they just jump to an insert for something that it's not going to help. Whereas maybe midfoot arthritis or plantar fasciitis, you might see some relief from that. So where does it go wrong? And I think it's that haphazard use. It's simple to just say, we're going to put you into a custom orthotic, and the patient may not need one. Reusing orthotics. What does that mean? Well, a patient comes in with a pair of orthotics that were 10 years old, and they don't have foot pain, and we're putting them into another custom orthotic that's $700. And And what's the reason that we're putting them in it? Well, they came in and said they needed a new pair, but we don't even really know why they had the orthotic to begin with. And then the other thing that can sometimes go wrong is a patient just simply needs surgery. And we all know that these patients are out there and they fail conservative therapy and they might need a fusion of some sort or a reconstruction or a metatarsal head resection, but they're being placed into an orthotic. So I think also when patients go to Google to fix foot pain, these are the things that pop up. Inserts are one of the leading solutions to foot pain, and they see this, and just a quick search on how to relieve pain on the bottom of your foot brought up one, two, three, four, five, six, seven, eight different items. Six of those are orthotics, so they don't know what to do. And then there's the Good Feet store, which, like it or not, a majority of our patients who are going there are seeing the ads. They're suffering from plantar fasciitis, which is one of the most common things that us as foot physicians treat. And they're going to the Good Feet store and they're getting frustrated because they're not getting help. So what is the Good Feet store? Well, they're a medical provider, but they're not a medical provider. So they're not able to diagnose, they're not able to prescribe, they can't fill prescriptions, and they can't accept or process insurance claims, but they can treat foot pain by dispensing insoles, not orthotics. They call them insoles. And it's pretty ingenious from a business standpoint. But when we look at this, what are they doing? Well, their widget is an insert, which we'll call an insole because they can't call it an orthotic. And the top of the pyramid is the franchise seller. And the franchise seller will sell these franchises to other people for an investment of about $250,000 to $587,000. And then there's a franchise fee of $25,000. So that's how you can obtain a good foot store. If you were to break this down, let's just say on average $418,000 to start a Good Feet store. If you're selling PowerSteps at $65 a pair, that's around 6,430 PowerSteps that you'd have to sell just to reach your initial investment. That doesn't count anything else. So what am I getting at with this? Well, they're not medical providers, and I think any of you out there that purchased or sold a practice, that amount's probably higher than most practices would sell for, and they're not even a medical practice. But it's economics, and everything revolves around money in society, whether you agree or disagree with that. That's just how things work. And I think patients are coming into these stores and they're there to have their foot pain fixed, and the person in the store is there to sell an orthotic. So if someone comes in with a bunion deformity and there's a crossover second toe and they have pain under their second MPJ, or what we want to call metatarsalgia, that could probably be fixed with a simple over-the-counter orthotic where you can reduce some of the pressure under the metatarsal heads with a met pad, which could probably cost that patient $65, but they're going to get a rigid insert from the Good Feet store that was supposed to be custom because they did a foot imprint, and pay anywhere from $1,200 to $2,000 for them. So I think the franchises have taken advantage of patients by selling them an experience as opposed to trying to treat a problem. And they really can't treat, they're just selling something. And, I have had patients that come into my office that will refuse $500 for a custom orthotic because of the price, but they'll have no problem going to the Good Feet store and paying $1,200 because they're paying for relief. While they may have got the same relief, it's just a different experience, and it's marketing that has captured that patient and brought them in. So it's just something else, and I know I'm sounding down on them. It's not their product; it's you're mixing medicine, or you're mixing podiatry with retail, and I think that's not a good thing to do. and they're improving the quality of lives through marketing. And so what are my patients saying? Well, they're getting frustrated because they're going in with pain, whatever it may be. Usually it's plantar fasciitis, and they're paying a lot of money and they're not getting the relief that they want. So how long will this last, do you think? Well, if you bought or sold a practice for $300,000 and you're only selling orthotics out of that practice, I think one would be able to figure out how long you'd be able to sustain that practice. So, how do I approach the use of orthotics? I think the first thing that I look at is what are we trying to accomplish? Who are we recommending orthotics to? And that's kind of how I break this down in this presentation is you have to dispense these orthotics to the right patient. So an overwhelming majority of my patients with plantar fasciitis are getting PowerStep orthotics. Now, if they've come in with an orthotic already, I won't reuse one. I mean, when you look at the studies on custom versus over-the-counter inserts, I think we know that over-the-counter inserts do very well at treating orthotics. So I'm not trying to capitalize on something that a patient already has or has tried. For example, if let's just use PowerStep as an example, and they have the ProTech line that's dispensed only in a doctor's office versus the Pinnacle line that's on retail stores. If they come in with a pair of Pinnacle orthotics and they tell me it's not helping their plantar fasciitis, or let's just use, I don't know, another competitor like Superfeet, and it hasn't helped their plantar fasciitis, well, I won't stop the use of that orthotic, but we're going to look at other things to help them. So we're trying to treat the condition with there's other ways, injections, stretching, you know all those things, but I have an algorithm that I follow and orthotics fits into that algorithm. But are they custom? Well, no. I'm using over-the-counter orthotics to treat my plantar fasciitis, period. What about patients who already have orthotics and they come in and they say, I need a new pair of orthotics. Mine are 10 years old. Well, more than likely, if they've been in something for 10 years and I've asked them why are they in them and they don't know, I probably won't put them in another pair of custom orthotics. I'll discuss with them, look, you really don't know why you're in it. You're only wearing them in certain shoes. You're not running in them. You're wearing them in your work shoes. Let's try to get you into a pair of over-the-counter ones. If they're not diabetic and their insurance isn't covering them, they can get an over-the-counter pair for a lot less than custom. I need them for all of my shoes. I have a lot of patients that don't want to wear that same pair, and it's not practical or rational to have a custom orthotic in every shoe. And that's another option of where I'll use an over-the-counter orthotic. Then there's that patient that just says, my feet hurt. And it's sometimes a personality situation where they're tired. They're on their feet all day. They really don't have a pathology. They try to wear sensible shoes, and maybe their income doesn't allow them to wear a higher end, rigid, supportive shoe. And orthotics can help these patients. And it might just be a situation where you've looked at this patient, I'm sure you've all seen this person that's come in and said, my feet hurt. And there's really nothing wrong. They don't have any arthritic changes. There's no overuse syndrome that you can find. They're just complaining of sore feet. Well, rather than waste, I shouldn't say waste, but rather than have that patient spend $800, $500, whatever you're charging for a custom orthotic, why not try an over-the-counter orthotic? And if they get relief with it and they're and then they want to invest in something custom, that's fine. But you'll find that a lot of these patients will do well with an over-the-counter insert. Teachers are another option of people who are on their feet all day and they're just looking for some, if you want to call it support, you can, but just something to reduce the stress on their feet from standing all day. And I will use inserts on patients like this as well. So teachers are another subcategory of patients that I like to introduce over-the-counter orthotics on, just because, as I said, they're on their feet all day and it helps give them support. I have flat feet. I don't know about you, but I see a lot of patients that come in They have nothing wrong with their foot. It's a, as I like to call it, a normal variant of flat feet or of a normal foot, maybe a little bit of a decreased arch, but it's not a true pathologic flat foot. And they are just dead set on something in their shoe. And you might say, you don't have a flat foot, you don't need a custom orthotic, but that patient just won't hear you. This is another great option for a patient. You can use an over the counter insert, it's very benign. Even though they don't have a severe pathology, this is going to help get them through the day to reduce the stress. Plus, it's making them feel better psychologically because they think they have flat feet. Even some mothers or fathers will come in with children and they were at the pediatrician who said they have a flat foot, they're running and they're in sports and they want to insert. I can't justify having a parent pay for a custom orthotic when that kid's going to grow out of it in 6 months. So this is another example of when I'll use an over the counter. And then when do I use orthotic patients, or I'm sorry, custom orthotics? It's a patient that truly needs a custom orthotic. They have to have a severe collapsed foot that probably, I used to say there's two ways to stabilize a subtalar joint. You can do it with an AFO, or you can put two screws across the subtalar joint. And I still really believe in that. Now, I'm not saying a custom insert won't help someone with a collapsed subtalar joint or flat foot or rear foot valgus, but it's pretty difficult to really control that motion with a shoe insert. And that's when you're going to go to an AFO. I'm also using them in post-op patients. So the minimally invasive bunion surgery that I do, I'm now introducing a Morton's extension from PowerStep, which has that rigid extension across the great toe joint. So instead of that patient being in a cam boot for 3 weeks, we're getting them out of it sometimes after a week and putting them into an insert like this that makes their shoe rigid and can reduce the stress on our osteotomy site. And then patients are feeling more comfortable with this and wearing it even longer. It's getting them back to activity faster. And then there's just sometimes where you have that patient, that 83-year-old that comes in with foot pain that you can't explain, but they want some type of treatment before they leave, even though they're not walking much. And sometimes that little bit of support from an insert will help. I threw this in because this happened to me today. This was a 73-year-old male who came in with his old custom orthotics and he wanted a new pair. And I asked him, why does he have those? And he had no idea why he was wearing custom orthotics. So he knew that he was dreading this appointment because they aren't covered by his insurance. And he wore these for 10 years and didn't want to pay for a new pair. And I, explained to him the science behind over the counter versus custom. And he walked out with a pair of PowerSteps today. And that's the beauty of it. And he's going to follow up, and whether he needs custom or not, it's will be determined, but it's very unlikely that we won't be able to achieve what he's been dealing with an over the counter. And these are the times, as I discussed before, if you're trying to offload a pressure point, be it an ulcer, a metatarsal callus, or severe posterior tibial tendon dysfunction where patients refuse AFOs, that's generally when I'm going to custom. But aside from that, I would say over 90% of the patients in my practice are getting an over-the-counter orthotic. So what does the science say about this? And this is where we see that, when you're looking and comparing custom versus over-the-counter, just to read our conclusion, all over-the-counter devices exhibited significant decreases in the plantar fascia strain compared to no orthotic, and only PowerStep exhibited significant decrease in peak rear foot eversion. Medial longitudinal arch deformation was not reduced for the over-the-counter, but the point being, we can treat plantar fasciitis with an over-the-counter orthotic. When we compare them to custom, there was no difference between custom-made and prefabbed orthoses for the reduction of functional improvement in short-term, medium-term, and long-term treatment in adult patients with plantar heel pain. So I think that the evidence is out there that plantar fasciitis without a doubt, can be treated with over-the-counter inserts. And there is limited evidence on which to base clinical decisions regarding the prescription of custom-made foot orthosis for the treatment of foot pain. And I think that's where, when we aren't sure what we're treating and patients are just getting subcategorized as having a pathology and told to get a custom orthotic, I think that's where those problems arise from. The effectiveness of foot orthoses to treat plantar fasciitis, a randomized trial. The customized and prefabbed orthoses used in this trial have similar effectiveness in the treatment of plantar fasciitis. And I think it's great to see this because we see a lot of plantar fasciitis that come into our office, and we can help them with an over-the-counter device and save them money as opposed to going to a good feet store and paying $1,200. And I can go on and on with a lot of these studies, but at the end of the day, if you're looking to treat plantar fasciitis, over the counter will do the job. So, in summary, what makes a patient unhappy with their inserts? I think we found that it's treating them haphazardly, putting them into an insert for something that they don't need it for. We talked about misleading marketing. And I think, what does the science say behind this? I think when we talked about what the science shows is we can accomplish the same thing in a lot of these patients with an over-the-counter device as opposed to using custom. So I would just like to end this by saying I don't want to sound like I'm bashing custom orthotics in our profession. But I think when you go back and look at this slide, I really want to show you this again. I think this is what happened where custom orthotics were abused and they weren't treating pathologies as they were intended to. And I think that's where the over-the-counter orthotics can be benign. They're intended to just give your foot some relief, give you some stress reduction to this plantar fascia and those muscles. So, yes, you might have a patient that has a severe valgus deformity, and that might be your patient for custom, but the overwhelming majority of your patients don't have that severe deformity and can benefit from an over-the-counter device. So I'm going to leave it there, and hopefully we have some questions, or if Mindy, you want to jump in.
I have to say, even with all of those technical difficulties, we did not lose a single person.
Really?
Yes. Apparently, everyone is so interested in what you had to say, they stuck around.
Well, I genuinely feel bad because I don't like technical difficulties, and this is
I know,
supposed to be
I know.
interesting and fun. So I'm truly sorry for those listeners out there.
No, it's fine. I was saying that at least everyone knows that we're actually live here. All right, so we do have some questions that popped in. One is, ad for good feet store notes in an uncontrolled study, 50% of patients with plantar fasciitis improved in 30 days. I don't know that that's a question, but would you like to respond?
Wait, can you say it again? Because I missed the first part.
Yeah. An ad for good feet store notes in an uncontrolled study, 50% of patients with plantar fasciitis improved in 30 days.
I'm sure they did, but did they have to spend $1,200 to get that same improvement? A $65 insert could probably do the same thing. And then they could take that other $1,300 and go on vacation with pain-free feet.
Do you have a specific OTC insert for patients with rigid pes cavus versus rigid flexible pes planus?
So, rigid pes cavus, I would treat with a comfortable running shoe. I don't know that I would put them in an orthotic. A flexible pes cavus, I would just try an over-the-counter orthotic. I use PowerStep, obviously, as we're working with them tonight, but that's what I recommend in my practice. But I wouldn't treat a pes cavus deformity with an orthotic.
Let's see. What
Unless
brand? Oh,
to
sorry.
back
Go ahead.
up, sorry, unless they had a like I don't treat pes cavus deformity. I would treat the metatarsalgia that they have and maybe use a met pad that you can get in a power step. But a high arch isn't symptomatic. It's the metatarsal heads that are symptomatic. It's the lateral ankle instability that becomes symptomatic from their pes cavus deformity. But if you understand physics or biomechanics, if you stick something under a high arched foot, you're reducing the stability of that arch. That's just simple physics. So pes cavus deformity creates plantar metatarsal head pain, which you might treat with a soft insert or a metatarsal pad, but you don't need to support their arch.
What brand do you recommend for OTC orthosis in children?
PowerStep, they have a children's orthotic. They're
Awesome.
just simple. I mean, they're easily available. They get delivered to my office within 24 to 48 hours. They're simple, they're inexpensive, and if they don't work, either there's two reasons that they don't work. One, the patient didn't need them, or two, there's something else going on that is causing the pain that we need. So if I try an over-the-counter orthotic and it doesn't work, I'm probably not going to go to custom. And that's pretty simple. You can usually get down that path by having the patient follow up and talk to them about their results.
Mindy, do you want to say anything about the PowerStep kids orthotics?
Sure, we have a full length and a three-quarter length. The three-quarter length is a posted insole. They're called Pinnacle Junior. So we have Pinnacle Junior full length, Pinnacle Junior three-quarter length. And what's great is that because they are affordable, because kids' feet grow so quickly, you can able to keep up with them by providing multiple pairs as their feet grow versus a custom solution. And they're fully cushioned to make them more comfortable. And it just gives them the stability in their shoe. A lot of the kids' shoes don't have a lot of support to them. So it just gives them a good foundation.
And I'll be
Awesome.
honest with you, Mindy and Ann, and the listeners, I don't even stock kids' orthotics. I just pull my phone out and go to Amazon or send them across the street to Lucky's. And you might say, well, yeah, but you're not benefiting from it economically or financially. At the end of the day, I am because I'm making that mom and dad happy, and then the patient or the son or daughter is happy, and then they tell their friends and family, "Oh, he told me to go on Amazon and buy this, and it helped my daughter." So, if you treat people the right way, they will come. I mean, their friends and family will come, and it does well.
Very true. Going back to regular orthotics, three-quarter length versus full length.
I
That's
ask the patient. Over the counter ones are full length generally, but I'll look at the patient and say, which ones are you comfortable with? And that just goes to show that, again, we're using orthotics a lot of times incorrectly. If we have to ask the patient, as I'm even telling you do you like the full length or the mid foot length? It's pretty clear that if you're treating a neuroma and you're putting them in a custom orthotic that's rigid, you've lost touch with what you're actually doing because at that point, you could treat a 4 foot problem with a non-custom device. So I think full length versus three-quarter length is just subjective.
And it depends on the shoe that they're going to be
True,
using them in
true.
as well. If their preferred footwear is a little bit tighter, not a lot of room in the shoe, then a three-quarter length might work better. I use my three-quarter lengths in my dress boots and my flats, which might not fit a full length insole.
Can I say something? And Mindy, don't get mad at me. Um, a lot of times, if a patient truly has a problem and we're trying to make them better, you've got to start with a good foundation and a good, comfortable shoe. And I make this statement a lot about dress shoe orthotics that are like custom orthotics or I mean, I get it. I know if that's the shoe we have to be in, but even though the topic of this lecture is, why are patients sometimes frustrated? If they're not educated and we don't explain that they shouldn't be in that shoe, that they should be wearing a better shoe, that's one thing. But at least if they understand, yeah, you can wear this dress shoe, but it's probably not going to help. And if you're going to maybe use this orthotic, but I would still rather, if I'm treating an injury or an ailment, I want them to be in a comfortable shoe. I don't know if that made
Good
sense.
correction.
Yeah.
That would be the doctor's advice.
Yes.
I mean, it's not
True
bad.
podiatrist says stay away from stilettos.
Exactly.
But I mean, there are times when you want to wear them, and I get it. And that insert will fit better in that, and it is better than none at all.
What is your strategy for selling custom orthotics after the patient is already aware about a cheaper version, such as PowerStep?
I really don't use them. And I just had a fellow with me today, and he was laughing. He's like, I can't believe I was at a practice last month that used custom orthotics all the time, and he's like, I'm not seeing you prescribe them. I really don't see a place for them unless, like I said, it's a severe deformity, a severe pathology, or it's a patient that needs something truly custom, like offloading a certain area that needs an accommodative custom. But I think I couldn't tell you the last time I wrote for a rigid custom orthotic. Usually they're accommodative.
What's the difference between the professional line and the regular PowerStep line? So the Pinnacle and the ProTech.
I'll let Mindy answer that.
Sure, I can. So the ProTech line is what it was designed for our medical professionals. It has similar support as the Pinnacle line, which is openly available, online and through local shoe stores and retailers. But the medical grade materials in the ProTech line just give it a little higher quality than the standard Pinnacle. A lot of the same styles are also available in both. But going along with the doctor's advice and the doctor's recommendations, ProTech is a superior product.
A couple follow-up questions. Mindy, how much is the ProTech line if a practice buys directly from you?
ProTech line varies amongst the styles, but generally they're going to be around $20 direct, and then MSRP on them we suggest around $50, $55, depending on the style as well.
Another question for you, Mindy. Will PowerStep consider making wide protect custom post? Does that make sense?
So the custom post is a really unique product that we offer. It has detachable heel lifts and heel wedges so that you can truly customize the posting on the heels. We don't have any plans to make that in wide fit, but we do have a ProTech control wide style that you could check out too. It's a 2-degree medial posting on that one, in a firmer shell as well.
Dr. Nick, can you talk about the practice management aspect of your PowerStep orthotics that you dispense with respect to keeping inventory in your office, and how much do you charge the patient for the device?
So I believe we charge $65 for ours, and maybe we're overcharging, Mindy, after I heard what you say. I'll have to check with my staff, but I'm in a large group, so I don't know, I don't really set the prices on those things. It gets set by our corporate. The way I do it is I preface my conversation with the patient and say, look, I'm not in retail. I'm not here to sell you inserts. We have them. They're out front. You can talk to my staff on the way out. This is what I recommend. I'd rather you get these than to waste your money at retail stores like Walmart or going on Amazon, because at least you know what you're getting from us. And if what we sell you doesn't work, I wouldn't spend your money elsewhere. I would come back to find out what other avenues we need to do to help treat your problem. And then patients that are already wearing them, and I see a lot of patients already that come in with PowerSteps in, and usually they're the over-the-counter or the Pinnacle ones, and then they'll ask me what's the difference in I explain this, the doctor grade, et cetera, and then they usually buy more. And sometimes patients just even stop in to buy them, but they're on display, and that's truthfully the only item that we dispense in our practice. That and an ankle brace that Power has as well. But we don't sell creams. We don't sell, and being in a large multi-specialty group, we aren't allowed to dispense certain things from certain accounts because it has to go through an approval process. And PowerStep is one of the devices that we are allowed to dispense just because of the, we really thought highly of it. And when we entered this arrangement with our group, it was one of the things that we fought for and said, this is what it's part of our practice.
And it's
Um,
also available same day when you're dispensing it. So your patient is walking out with the solution and not having to wait or decide on their own of what they're going to purchase somewhere else.
Mm-hmm.
Mindy, do you have a link to the PowerStep Pinnacle Junior that you can pop into the chat
Yep.
for everybody?
I can do that.
Okay, cool. So I'm going to dismiss that question. Let's see. We did that
I'm going to
one.
add something else, Anne, while you're looking. You know, patients are smart and they can become smarter by going to the internet. So if you tell a patient that they need a custom orthotic for plantar fasciitis, they're going to go home and look it up. If you know, so it's and insurance companies have caught on as well, and they're not reimbursing for custom all the time. So I think the evidence is pretty solid that you don't need custom to treat something like plantar fasciitis. So I think the standard of care has evolved into using an over-the-counter device to treat this condition.
What differentiates PowerStep versus other OTC orthotics?
Oh, great question. One thing that we're very proud of is that we are the #1 recommended podiatrist recommended insole. So we put a lot of pride in that, and it's earned because of I think it's the quality of the product and primarily the effectiveness of the product. We have clinical research that backs it all up. You can read about that on our website as well. There's a link to that on powerstep.com. And it's just how it supports the foot. It's like Dr. Nick was saying that customs, or like the sunglass example, it does the same thing. It just does it in a maybe a little bit different way. So it's the length of the arch. It's how the arch kind of goes across the whole foot instead of just a quick up on the medial side and then down. It's more traverse across the foot. So there's different ways of the shell shape that really make it effective. It's based off of scans of feet that our podiatrist way back almost 20 years ago has designed and developed the PowerStep based off of scans of feet and noticed that 80% of the people had the same kind of custom shape and it became the PowerStep arch.
Wow, you liked my sunglass analogy.
It makes sense. Does the same thing, just a little different. I know that other brands kind of, the arch shifts or the arch shape is different or how it controls. We also have the rear foot, a heel cup, a nice deep heel cup in the insole too. So it's going to help align the back of the foot the same way.
And I think from I hate to say practice management from an economic standpoint, but if you sell someone a $700 insert and they don't get relief, they're going to be upset. But if you sell them a 65 or whatever $50 insert, they might be upset, but they're going to come back to you because they're still going to trust you to find out. They're more likely to trust you because you didn't make them spend $600 on something that maybe they didn't need.
So there is, okay, so Dr. Nick's email address is on the screen now. It's feet@me.com. There's one last comment. Disagree for every feet are different. So OTC orthotics and insoles might not work at all times.
I think it goes back to what are we treating, and I think that's why orthotics sometimes frustrate our patient is we're using them when we're using them either haphazardly or we're using them when we shouldn't be.
Okay, so it looks like we have answered all of our questions, and I have to tell you guys, I'm thrilled that we had like a good list of questions. And Mindy, where can we see PowerStep out on the road?
Yeah, in March, you can see us at ACFAS. That's going to be in Phoenix. And then in April, we'll be at Present Desert Foot. I think it's the East one in New Jersey. So stop by the booth. We get samples out and you can try the product for yourself.
And Dr. Nick, are you lecturing anywhere anytime soon?
I will, well, a local one in Columbus. I will be at another one in September. I will be in Nashville for Tennessee's state conference. Arthrex in June. If anyone's, I don't know if I'm allowed to discuss that. There's a
Sure.
DPM workshop in June. If you want to talk to any of your Arthrex representatives, there's a 2-day conference that we'll be doing there, talking about foot and ankle surgery. And on my,
Is it a
you can,
cadaver lab?
yeah, there's cadaver lab as well as half day in the lab and half day in lecture, and it's for 2 days. So
Awesome.
reach out to your Arthrex reps about that.
Cool. We have a couple more, we have these webinars a couple times a month. Our next one is March 24th, and that is sponsored by SureFit. It'll be about incorporating ESWT shockwave into your practice. So mark your calendar for that. And then in April, Dr. Chris Milkey is coming back. He's going to talk about marketing. So the Dr. Milkey webinars are always very well attended, very interesting. So if you're interested in marketing at all, mark your calendar for April 7th. And any final words from the PowerStep crew?
No, I think this has been really great. I'm glad to be able to share more about our products to people who it sounds like haven't had much experience with PowerStep.
Yeah, well, you guys did a great job and we ended right on time. So kudos.
Awesome.
Good job
Yeah,
all around.
I was just going to say, if anyone wants to ask me any questions, please feel free to drop a line to my email. I have no problems talking with you, having any more dialogue about PowerStep and how I use it in my practice and how I educate my fellows and residents on how to use it, how we dispense them, and why I choose to do that. So thanks.
Thank you. Mindy, there's one more question. How can we order direct from PowerStep? And I know that you got, like, I could just say powerstep.com, but I think there's a physician link, isn't there?
Yeah, we our parent company is Foundation Wellness. So foundationwellness.com is where you would go for that. And I could probably drop the link for that too. But there should be a form you could fill out, and then our sales rep will get in touch with you, or you can just call our direct customer service line, 888-237-3668, and they're going to direct you to or get the message along to your local sales rep. So we do have a national sales force outside, and then for those states and areas that aren't covered, we certainly have an inside organization that will handle your account for you. We'd love to get you started.
Thank you, everyone, and we will see you next time. Have a good night.